Okay, so as you say, it's becoming evident. Then what happened when he went back to Florida? Did you then had to decide to relocate him?
So over the course of the summer of 2018, it became evident due to his lack of hygiene. He wasn't showering. He wasn't brushing his teeth. And we also noted changes in his bathroom.
Right,
Urinating on himself.
Incontinent,
defecating on himself. We would find evidence of feces in the bed, and then he's not showering.
Wow.
And I, in conversation with my sisters, said, I don't know if it's the grief or something else. So I took him to my primary care physician and said, we think it's just the grief and aging. My dad, by the way, at that time was about 74 at that time. Yeah. So I actually then had to hire help. So I reached out through my primary care physician, I reached out to one of the local agencies.
Right, home health?
Yeah, so they would come in and have them come in.
Visiting nurse or something like that, yeah.
But there was tension with Dad. Dad, I said, Dad, I think you need help with certain things. And Dad was still there. Okay. And so he was, what do I need help with? What are you talking about? And so the first time that the person came and I introduced, he get out of the house. I don't want you here. It was like, okay, I recognize that he needs help, right. But he is saying, I don't need help. What are you talking about?
Right.
And so it was the tension of, I'm not really sure what's going on. I'm not sure if it's the grief. And then if it's the grief, then he's just not taking care of himself because of the grief. But that's not my dad. Dad was clean. He dressed up.
Right.
He always had a bunch of colognes. He took care. He looked good.
Right.
So I would say, oh my God, this, grief is really, really bad. And thinking that, most people by this time now, almost 3 years after Mom's death, he was still behaving with the same level of grief as day one. And I'm saying to myself, maybe he needs counseling. But how do you suggest counseling to a Jamaican man? Right. That's taboo. No.
Yeah.
So none of my conversations with him about you need help were working. He's like, no one would come. And so the person would come and I would basically have her clean up his laundry and stuff, but he refused to have them touch him.
Oh, so it became, okay, so you wanted additional help, like to help with the shower and sort of his daily activities.
Yeah, because he wasn't doing that for himself. But then my question was, is he not doing it because he's grieving or another reason? And so
was he was here in Jersey, not in Florida?
He was here with me in New Jersey.
Jersey. Okay, yeah.
So he was with me in the summer of 2018 for about, let's say from June until about October.
Okay.
And I recognized that something is not right. Those habits that I described became worse. So I said to my cousin, who's like a brother, we need a diagnosis. So he went with him to Florida to figure out what's going on.
Oh, so you asked your cousin to go with your father back to Florida to tap into his medical team there to figure out what's going on.
Correct.
Okay, brilliant.
Because I had a conversation with my primary care doctor. I said, I think it's beyond grief because there were things such as one day it was so funny because I took a picture of it. I gave him dinner and then he came back and he had finished eating and cleared his plate. And then I there's a little powder room on the floor of the dining room and there's salad in the toilet bowl.
Okay.
And I'm just standing there looking because I'm confused about the salad in the toilet bowl. So I took a picture and I was going to I shared it, I think, with my family, like, look, there's salad in the toilet bowl. And I was like, he thinks it's the garbage can. So there were those kinds of, those kinds of things prompted me now saying we need a diagnosis to get help. So long story short, my cousin went with him to Florida. Mm-hmm. And he had a battery of tests done, and they did the MRI, whatever other things they did. And he was diagnosed with Alzheimer's disease.
Okay. Just before we continue with that, what was that like for you? So your cousin represented you all with your dad at the doctor. Did that require any legal consent or proxy or things of that nature at all, or you don't? It wasn't an issue because that was pre-diagnosis.
It was pre-diagnosis. So Dad was still able to understand many, many things.
Okay, got it.
But there were some things he didn't know. So coming back to the reasons why I said we need a diagnosis. So I would share with my primary care physician, who became his doctor while we were here. And she would ask him questions like, okay, what month is it? And he wouldn't be able to answer and those types of things. So it became evident that his memory was slipping. My primary care physician, she's from Nevis, but she went to medical school at the University of West Indies in Jamaica. So she knew a lot of Jamaican cultures. And so she would be able to speak a little bit of Patois and just joke with him about certain things related to Jamaica. So she was very good in.
So there was a cultural component to that.
There was a cultural component.
And a deeper understanding, too, because if you don't understand Patois and the culture and certain phrases and terminologies, then how can you make an effective diagnosis, right?
My dad left Jamaica in his early 20s, and the Patois never changed.
Right.
Even to the point that my children would ask me to translate Patois because it's very rich and heavy. Yes. It never ever went away. So yes. Wow. So yes, I had to seek out that, because no one could understand him otherwise. So she understood, and I said to her, that's what I'm going to do. And my cousin who went with him was my father's best friend. He's younger than my father, but they are very, very close. So he's somebody who I trust. He's my brother.
Right.
So it goes going back to the village kind of analogy. Right. So, and he had visited the family in Florida at the house many times. So anyway. So he was there, and it took a while. So over the month of October of 2018, he was getting diagnosed, and we got the diagnosis. Mm-hmm. Within that time that my father was with my cousin, the decline was precipitous.
Really?
He went from being a 74-year-old man to now not remembering anything. So things became full-fledged. My cousin was with me on the phone and talking about my cousin is now having to shower him, having
the same cousin
now.
So he became a caretaker in Florida.
In Florida within that time.
Wow.
That's how fast the decline was. My cousin now has to leave Florida, and so this is where things start to get very heavy for me. My sister who lived in Florida, when we got the diagnosis, it was like, now what do we do?
Right.
So she said, well, I'm going to take him down to me in South Florida. I flew down to help the move
transition,
to drive him down there. So again, I get up and I fly down to move. Let me back up a little bit. Once I got the diagnosis, I asked his doctor, what should we do?
Right.
And she said, contact hospice.
Really?
And that is when I said to her, but isn't hospice for people that are terminal and dying?
Right.
And she said, no. Many people believe that. But hospice is care for individuals where there is no help. And for people with Alzheimer's, there's no cure and there is no help. It's a decline. So they will be able to help you. So I said, okay. So as soon as I got that diagnosis, shared it with my sisters, and I said, okay, I'm flying down to Florida. Again, flying down. Say I flew down on a Monday. the hospice folks came in and registered Dad into hospice that Tuesday or so.
With your consent or without your consent?
With my consent. I met the representative here.
Yeah.
The hospice that we went with was, I think it's called Vitas, Vitas, and they're national.
Right.
So what I said to them is that, yeah, my father's in Palm Coast, Florida, but he's going down to southern Florida. And she said it doesn't matter because we're national. Once he gets down there, then the team there will come in.
Right.
So they came in and they registered him, and we talked about his care and everything that they provide. And everything was all set for me to leave on the Thursday morning to drive him down to Florida, to southern Florida. And that Wednesday night, I get a text from my sister saying, I'm sorry, I cannot take care of Dad.
Wow.
And so it was a text, and I was flabbergasted. And then I said, okay. And I had to say, okay.
Rally the troops.
I said, well, I have to take Dad home with me.
Right. You can't do right.
Correct.
Yeah.
So now I contact hospice and say, Dad's not going to South Florida. Yeah. He will be in Maplewood, New Jersey. They said, as soon as you land, give us a call.
Okay.
So now I'm left to flying with a man who is now a declining dementia case by myself. He pees and poops on himself.
Oh my gosh.
I've not gotten to the point of, we're not even talking about diapering or anything yet. Right. But he's now become, I would say he's now a 3-4-year-old. That's how fast the decline is. Okay. And I have to get him on a plane. And first, we're far away from the airport, but the travel. And he's not even, I can't even get him a seat by me.
And you're by yourself.
And I'm by myself.
Oh my God.
And I'm like, just praying that nothing happens, that he doesn't soil himself on the plane.
Right.
And everything.
Right.
And he's now doesn't know anything. He's not able to really walk that well. That was part of his decline. He walked with a shuffle, and he was, so, there's wheelchairs. So anyway, nothing happens. I get him to New Jersey. I call hospice, and they come right away. And then now he's here and begins the part of taking care of him in my home, which was totally unplanned.
Right.
And so now we are going to have to deal with I'm taking care of my dad, who is now Alzheimer's. Full on. And there was no plan for that to happen.
Right. And but you have adult kids that live with you as well.
Well, at that time, my son was in college away. And my daughter was not home. She was still living in Philadelphia at that time. And so it was me and Oscar.
Yeah.
So I reached out to the village.
The village that you lived, or the hospice care agency?
So it was a combination of everyone. So my father has a huge extended family in the Bronx.
Oh, you meant the village?
The village,
his extended family. Got it. I thought you meant where you live at. Okay.
Huge extended family in the Bronx, and reached out to my aunts aunt who's a home health aide and a social worker. And I said, I need help.
Okay.
And my aunt goes to a church where most of those women in the Bronx in that church are live-ins.
Caretakers.
Live-ins. And I said, I need a live-in because we cannot leave Dad a home alone.
Right.
Hospice provided care for a limited time. Someone would come in and get him up and help with the bathing and the dressing and things like that. But I'm at work, Oscar's at work, and he needs 24-hour care because he falls and he experienced sundowning.
What's that?
Sundowning is when it tends to happen in the evening time of Alzheimer's patient, where they begin to have the episodes of fear. With Alzheimer's, the short-term memory is gone. So my dad didn't remember who his wife was. I would mention my mom. He had no idea who she was. So what he remembered was his childhood in Westmoreland, Jamaica.
Wow.
And his mantra was, I'm going back to Westmoreland. And he would say, what time's the bus coming to go to Westmoreland? Or when are you taking me to Westmoreland? So there was the risk of him leaving the house and wandering, which is a risk with Alzheimer's.
Right.
So he couldn't be left alone.
Right.
And in the nighttime, the sundowning would occur. So we needed help. So that means I couldn't go anywhere.
Right,
because even to run an errand in the evening time, because the episodes could happen.
Right.
That's a whole nother episode about what happens, what we experience with somebody with Alzheimer's. But we were very fortunate that my aunt, found someone in the church who agreed to come a live-in. And she came in and she would be with us from Monday morning through Fridays. And on the weekends, my family and I would take care of my dad. From that agency that I had the previous year, there was a Jamaican lady who would come once in a while.
From the hospice agency?
No, from the summer before the diagnosis.
Okay.
Yeah, who would come and she said, if you ever need help, privately, just call me. So once I got Dad back, this is now fast forwarding a year, that summer, that fall, I said, hey, Dad was diagnosed with Alzheimer's. I'm going to need some help on the weekends because she had said, if you need any help on the weekend.
Right.
So on some weekends, she would come and stay and help with the care.
Wow.
Hospice, my mom was brilliant. The basement that she set up was perfect for
hospice. Yeah.
Yes, because we had the bedroom there. We had an egress window. It was all set up. So the hospice brought in a hospital bed for him and everything that we needed to take care of him. Hospice, in addition to having the person come in Monday through Friday, 2 hours a day to help, the nurses would come in. The doctor would come in.
Really?
A podiatrist would come in to have care. And so we even had volunteers who came in. So there was there was a lady named Olga who would come every Friday to give Janet his live-in reprieve. So she would come in and play games with Dad.
Wow.
And she they got along so well. She loved my dad's Jamaican accent. So they got along so well.
So what was covered, if you don't mind me asking, how was this all covered? Was it through his insurance?
Yeah,
Wow.
So my dad was a teacher here in New Jersey. He had really good hospital healthcare coverage, good old New Jersey pension. And hospice is covered, I believe, and forgive me, I don't know all the details, but I believe it's part of Medicare.
Wow.
And so we didn't pay for any of his costs.
Really? Because I was under the notion that some of this, they may have limited coverage and then after we have to sort of cater for, okay.
No, I paid for nothing for hospice. Even when he was seeing my doctor here in New Jersey, he was covered. So we just paid the copay to my primary, but he was under hospice care. So we never had to pay for any of the hospice care.
So what I'm hearing is that you really have to be astute to your parent medical condition, because had it not been for that diagnosis of Alzheimer's, then they wouldn't have qualified him to receive all these services under the insurance.
You need a diagnosis. And so that's what I said to my cousin, is that you need to get him diagnosed to now be able to get the care.
Okay.
And so when I heard about hospice, I wasn't expecting hospice to come up because I needed to learn, what does a diagnosis of Alzheimer's mean? We needed to be educated,
Right.
my sisters and I, to make a decision about it.
Got it.
My sister in Arizona, when her father-in-law was diagnosed, they decided to put him in a home, but the home that they put him in was a home that was a family-based kind of daycare center.
Oh, really?
So it was a family that were taking care of maybe 2 to 3 different Alzheimer's patients. And,
I've never heard of that.
And I had no familiarity with it as well.
Wow.
And so it could be that it was specific to ours.
Right.
I don't know.
Right.
But that's how that worked for them because of his particular, the way that his decline was.
Wow.
But my dad was so precipitous, and I never was able to catch up. We were always thinking, okay, let's get him settled, and then we'll kind of have the conversation about the long term.
Right.
But things
it declined rapidly.
It went so fast.
Wow. So, okay, so now your dad needs 24/7 care. You have the hospice care. It's covered through insurance, thank God. Who makes the medical decision? How did that all unfold? Like healthcare proxy, DNR, or whether you had it or not, or power of attorney. How did that came about?
So in that summer of 2018, when we realized we're seeing the decline, when I then got the help from the local agency just to come in and help with the hygiene, we went out and made me the power of attorney right away. Before, because we saw the decline.
So you didn't wait. You jumped on it immediately.
Because one of the things, for example, I was helping him with his taxes, and then I asked him to sign, and he couldn't write. And I noticed that his
and that's what made you,
things are declining really fast. So I immediately went and set everything up. So I became the power of attorney right away because we realized we had no time. My mom was brilliant. My mom had taken care of all of the funeral expenses.
For both of them?
For both of them. And all three of us had the paperwork, everything done. So for my mom's funeral, the only thing that we had to choose was the color of her flowers. She had taken care of everything. So we knew all of that. And so we knew we didn't have to worry. So she took care of that as soon as she retired. Both of them took care of it. Yeah, immediately.
Okay. Wow. This is incredible.